Hi, I'm Dr. Nicole Farrar, Clinical Associate Professor and Chair of the Medical Education Department at Oklahoma State University Center for Health Sciences. I'm joined by my faculty colleague, Dr. Dolores Vazquez Sanroman from the Department of Anatomy and Cell Biology today. Welcome, Dr. Sanroman. Thank you for joining me. We're going to work through our community Voices for Health interview today. But first, I'd like to ask you to tell us a little bit about yourself.
Sure. Thank you so much for having me. I'm really excited to be here. As Dr. Farrar said, I am an associate professor and researcher in anatomy and cell biology here at the Oklahoma State University Center for Health and Sciences. And a little bit about me, I have been at OSU since 2016. And I have been very blessed to have the opportunity to interact with amazing faculty, amazing student body. So I'm very grateful to be here. I am a single mom of two beautiful boys and very busy, but really happy to be here today.
Thank you. All right, well, we're going to jump right into some of our questions. So I know you had the opportunity to watch our primer on social determinants of health. So what were your first thoughts about your community and the impacts that you've seen through those social determinants of health?
It was very revealing for me, and I think it's very important that we teach our medical students how important it is to give voice to communities and understand, and then as a future clinicians to understand how important and pivotal is advocate for their patients and know what are the social determinants that can trim the healthcare, the access to care. So it was quite revealing and very insightful, and at the same time filled me up with a lot of excitement because it's like we are working towards something that can build up in our communities, and it was really insightful.
Yeah. I love the excitement part. That's how I feel about it as well. So kind of reflecting on that again, that piece in the primer, how have you seen those social determinants of health affect your life and your experiences?
That is a very important question because I am not only a Hispanic first-generation immigrant in the United States, but also I am a mom of two boys. So then the social determinants is really how you see it on the different stages of my life. I was born and raised in Mexico, so we are considered a low-income country. And we do not have the same health structure that you guys have here in the United States. So there is not such a concept as medical insurance. So you have something that is called or is aligned more with universal healthcare. So in theory, no matter what is your social economical income, you can have access to healthcare. The thing is, the quality of that healthcare is not the best. Mm-hmm. So, for example, for giving you a specific anecdote about this is, I never have an annual exam being in Mexico. It was not something that was required for me. However, if I need a surgery, for example, I have to have my gallbladder removed. I have access to the best hospitals that were in Mexico, the best healthcare, but it was when the problem was there.
Sure.
So something that I observed that is quite contrasting between low-income countries as Mexico and United States is that United States healthcare try to advocate for preventive medicine. And I think that is not only in benefit of social and economics as a country, but also allow you to prevent and advocate for different situations that your patient can observe. So I think for me, having access to a different type of healthcare system make me aware about the disparities that low income and then high income countries actually observe. But then I get into the part of as a middle class citizen here in the United States, you don't really fit within any of the big categories, which is either higher bracket or very low bracket. Sure. So then as a middle income citizen, you have to struggle and try to fit what the medical insurance requirements are, and sometimes it is very expensive. So, for example, a trip to the emergency room is something that we definitely think about. Like, is that really necessary? Are we, because it's quite expensive. So, and I am probably talking from a quite privileged point of view because I'm a middle class citizen, but if you think about the rural communities or rural access to it, the layer of complexity, the layer of access is just make it more complicated. So I think is very important the preventive medicine that United States focus on, because allow us to advocate early, allow us to prevent bleeding of money that perhaps that family or that person does not have, and then utilize the resources for healthcare in a better way.
Sure. So along those lines then, having family and growing up in Mexico and then that transition to the States, have you seen other family members impacted or colleagues, friends by these social determinants that maybe go along that contrast between Mexico and the U.S. and how that works?
Yeah, so I was able to witness that in first person because one of my cousins, one of her babies was a premature baby. Mm-hmm. So one of the reasons that precipitate the delivery was some respiratory issues that was happening with the baby. So they delivered the baby. It was a 7-month premature baby. So they rushed them into the NICU, and eventually he progressed very well. He did okay. But when I was pregnant with my first boy, we did have I developed something, some preeclampsia, so I have to be in a bed rest type situation. Mm-hmm. But one of my OBGYN actually, I was quite concerned for an early delivery, and he's like, no, we are going to administer some steroid, I don't know what is really the terminology for it, so we can provide or we can help or boost the maturity of the respiratory system and the cardiovascular system. So that prevent of an early delivery, and that was something that my cousin do not have access to it. So when I ask about the cost to my OBGYN, it's like, no, it's covered by my insurance. And then it's like, okay, that for me is a clear example of that disparity. So I think education and country development definitely influence the healthcare and how the healthcare outcomes at the end of the day. And then, for example, also with my father, he's a diabetic and hypertensive. Mm-hmm. And the controls that they follow probably is the opposite situation, because here I listening how difficult it is or how expensive it is getting insulin treatments. In Mexico, it's free. So we did get access to insulin. If you are a diabetic and you require insulin treatment, you do not pay anything for it. Nothing. No cost. So that is like another, like a mirror situation, right? When it's like health disparities and healthcare systems are different and approach disease in a different way. So
sure. Well, it's really interesting. I learn things every day getting to visit with you guys. So addressing these social determinants of health, how have you and maybe your community worked to try to address some of these issues?
That is something very important, because when I get to United States in 2014 and later in 2016 here at OSU, I find a very important niche of Hispanic community here in Tulsa. And I was very committed to try to serve, improve, and work with that community. And I find out that education is really one of the best allies that we have for that. And for example, it's not a commercial, but one of my medical student advisees is an Albert Schweitzer Fellow. Mm-hmm. And she has been working, I don't know if I am allowed to say the name of that person, but I'm going to go ahead and say it, Paul Delgado. So she's an Albert Schweitzer Fellow, and she developed this amazing program in collaboration with UMA here in Tulsa. Mm-hmm. So they were cooking lessons and cardiovascular type adapted, public adaptive lessons. So she was very passionate about educate that community and serve that community. So, and then we are partnering also with Dr. Colony Fulgate to kind of like try to roll some early life experiences and adversity programs so we can educate our medical students about the relevance of ask and advocate when your patients are experiencing adversity. So I think from my perspective, if the fact that I'm not a clinician, but I am a researcher, the way how I think I can help my community is facilitating opportunities to promote education, not only within the Hispanic community, but in my community, like within the university, and then with other groups. So.
That's wonderful. Yeah, I mean, huge impact with that program. I've heard all about it, actually, so
Okay,
it was
good.
excellent work. So then kind of building, right? You just talked about our community, university, and our local community. What would you want the larger community, state of Oklahoma, go all the way to the President of the United States? What do you want the bigger community to know about the importance of these social determinants of health?
So I think if I could say is multidisciplinary work. I think that the purpose of giving voices to different members of our community is provide different perspectives. So, for example, the school education system, the public education system here in Oklahoma is tremendously overwhelmed. And we were keep seeing what are the effects of the COVID-19 pandemic, and we keep saying that we are behind. And I think it's like at some point I would like to see it's like, no, we are not behind. We are just here, so let's just ramp up and go for it, right? Because we are behind from who? Like the entire world was affected, right?
Right.
So I think it's having a multidisciplinary team where you can have people from different areas, from different perspectives, coming together and work together to perhaps utopically develop a team that advocate for the different needs in the community, I think is very, very important. Having different perspectives from my point of view enrich that development.
Yeah, I think that's excellent. Trying to work together, right? That's what we teach our students. That's
Yeah.
how we talk about partnering with your patients.
Yes.
So the global partnership.
Exactly.
So I love that. So final thoughts. Can you kind of expound on what gives you hope for the future as we talk about the health of our community, the local Tulsa community, our institution, and maybe even broader?
Well, what gives me hope is that, and it's something that I always feel really proud about working at OSU, and is the sense of a family-directed environment. And I think is in the community service that are that drive our students, our medical students. So I think my hope is that as an institution, we keep working towards giving voice to these different communities to sensitize and create empathy in our medical students about how important is ask, advocate, identify the needs. And I think that is very much aligned with the osteopathic philosophy, right? So we want to talk about how mind, body, and spirit can work together. So I think that our medical students are being trained in a very successful way to identify not only what is the source of that disease, but how to treat that disease, but also prevent that and understand the whole group of factors that are surrounding that person. And then how can you advocate, how can you develop a better treatment, almost like a individualized treatment, right? Mm-hmm. Because every mind, every body, every spirit is different. And I think as that gives me hopes. Keep working with these amazing medical students and this amazing faculty group and institution that is gearing towards that goal. Thanks. So, yeah.
Well, all of that incredibly insightful. I really enjoyed visiting with you. Thank you so much for your time today.
Yeah, thank you for having me here.
Of course.